Today's show is prescription pills to heroin. People wonder, how did we get here? And you know, Dr. Hesse, could you give us some background of how did we get to this place that we're losing 44 people a day to opiate overdoses? I mean...
Yeah, it really started in the 1990s that there was this movement by the Purdue pharma company to promote OxyContin as a new pain medication. They had an active marketing campaign that pretty much promised that no American should have pain or have to deal with it for more than the time it takes to take a pill. So as things went along, they advertised to doctors, they advertised on TV, and by 2000 we already had a pretty well-established opiate epidemic due to prescription narcotics.
People have these meds in their medicine cabinet. They got the Percocets, they got the Vicodins, they have the Oxys, and they don't know that it is addictive.
Yeah, that's a big source of getting drugs for friends and relatives. So if there's one easy prevention step, it would be to clean out your medicine cabinet.
What we started to see was a higher percentage of young people, as young as 16, 17, coming in with opiate abuse issues and opioid dependency issues. Many of them were young people that were prescribed medications for sports-related injuries or repetitive trauma-related injuries, and as a result, began to abuse their medications.
They start with the opiates for the pain meds and injury, like you said, but then they move on to heroin because heroin is cheaper. I mean, the pills, you can pay $80 a pill. After a while, you can't afford it.
And so they start with the sniffing of heroin because for $8 to $10 you can get a bag of heroin.
It takes a week, 2 weeks to a month to become physically dependent. And at that point, your body actually needs to have the opiate or you'll feel sick. So you have cramps, a lot of pain, usually backaches and bone pain, real agitation and restlessness that you can't sleep, nothing feels comfortable. Right. And it goes on for up to a week. And that's a danger point for overdoses as well, because every day that you don't use, your tolerance drops. Right. So even coming out of a short detox, somebody's tolerance would be low enough that they could use their same dose and overdose the first time they use. Around 2004, naltrexone came out as a blocking medication for alcohol and opiates, and that's a non-narcotic. By 2005 or 6, Suboxone came out, which is a maintenance narcotic that helps remove cravings and prevents some of the drug behavior to go seeking drugs.
Could you tell us a little bit about the difference between methadone and Suboxone?
Methadone and Suboxone are both synthetic narcotics, but the Suboxone has what they call a ceiling effect, that once you take more than your usual dose, it actually doesn't make you high. But the big point of both Suboxone and Vivitrol is that they remove the cravings. Doesn't take it away completely, but it's not a strong craving that you're going to feel that you have to do something about. In 2013, the total overdose deaths for all drugs in the United States was 43,000. This is the opiate overdose kit that's being provided by the New York Department of Health.
So this is called Narcan, that is the brand name of it, or what?
Naloxone.
Naloxone, okay, is a generic term, and this can save someone's life.
I think it should be even parents, family members of someone that they know is addicted to heroin or using heroin should have that in their homes. I think that, once again, it's about saving lives.
Arms Acres is a rehab in Carmel, New York. It's only a half a mile from here. We do a detox there for adolescents and adults. The main thing we detox is still alcohol, but the heroin and opiates in general are up to close to 50% of the detoxes.